Hello, my name is Chloe and this is a case study for EXSC 515 assignment 2. I'm here today with Jane, who has recently been diagnosed with osteopenia after fracturing her right collarbone due to a fall. Jane is a very active person. She cycles 170 kilometers per week, although with her recent diagnosis, she understands her exercise program will need to incorporate resistance training to preserve her current bone mass density, as cycling is a non-weight bearing exercise. Cycling is frequently associated with lower levels of bone mass due to the lack of mechanical load placed on the bone tissue, which is needed to maintain bone strength, and the long hours in a weighted support position, sitting on a bike, doesn't help. Jane also has a family history of fractured bones and wants to change her routine to prevent future fractures. A final stage exercise program has been designed for Jane that incorporates resistance training into her current routine to help regain strength after her clavicle fracture, while also building up full body strength to reduce the chance of further injury. The program is in line with resistance training guidelines for older athletes, which includes 3 45-minute full body sessions per week with a greater focus on upper body, and can be included into her current routine. Each session starts with 3 mobility or balance exercises for her lower body and upper body to help increase her range of motion of joints and prevent general aches and pain with everyday life. Following this, 2 lower body exercises and 4 upper body exercises with resistance training. To end the session, I've prescribed 3 static stretches that aid recovery, support and improve range of motion and also flexibility. Each session will deliver a different variety of exercises, and the program can be repeated in the following weeks with progression suited to Jane. Jane is suggested to also reduce the amount of cycling to allow time and recovery for this exercise program. So we'll get started with the demonstrations. I'll demonstrate one at a time, and then Jane will complete 1 set of each. All right, so the first exercise we have today is lateral and front raises. So grabbing 3 kilo dumbbells, Jane, I'm going to get you to do the front raises. So you want to start standing up tall, proud chest, and you want to keep the weight horizontal, so only lifting to about shoulder height. So what I'm going to do, I'm going to ask you just to sit back a little bit just so I don't hit you. So standing out proud, feet about shoulder width apart. You want to go horizontal to your shoulders. So raise up, 1, 2, pause, 1, 2, coming down, up again, 1, 2, pause, coming down, 1, 2. All right, so I'll give you the dumbbells. So I'll just get you to stand up. You can face the wall here just so you have a bit more room. When you're ready. Okay, so Jade, I'm going to get you to keep your arms straight in the exercise and really slow down that movement for me. So lateral first, 1, 2, pause, good, and then come down, 1, 2, and then front raises. 1, 2, keep your arms straight still for me, down again, 1, 2. All right, so we're going to do 9 more of those. Keep going, 1, 2, and down, 1, 2, keep your arms straight, very good. And again, 1, 2, down, 2, 2, good. And down again, nice. Make sure you're keeping that proud chest for me. Up again. Really good. Keep that momentum going for me. Straight. Very nice. That's 4. Good. Just slow down the up for me. Good. 1, 2. Good. Pause. And down. 6. Good. Really nice. Straight back. 3 more. Good. Keep your arms horizontal to your shoulders. Yeah, perfect, like that. Now go again. And down. Good. In line with your shoulders. Very nice. How did that feel for you?
Very painful.
out of 7?
Pass.
Painful or doable?
Doable.
Very good. The next one I'm going to get you to do, Jane, is a single arm row.
Yep.
So I'll just get you to jump off the bench and move this camera down so we can see. Very good. So what I'm going to get you to do, I want you to support your weight with the bench. So because it's single arm, I'm going to get you to lean over, hand on the bench, grab the weight. You can keep a slight bend in this knee just to for stability. Start with your arms straight, back flat, neutral spine, and you want to pull the weight right up to your torso. So directly pull it up like this, connected to like a wire. So you don't go out, you don't come in, just pull directly up. All right, and we're going to do 8 of these. So I'll get you to start on your left side. Support your weight for me. So keep your back flat, head in a neutral position, and you want to pull your arm straight up. Bending your elbow when you pull up. Go again. Very good. And come down. So you're going to keep that similar tempo as the last exercise. Up, 1, 2, 3, and down. Keep your arms in a neutral position, so straight. Very nice. I want you to squeeze and come down. Squeeze. Very good. That's fine. Keep it going here. Squeeze. Back flat. Very nice. Good. One more. Now, Jane, the last exercise we're going to do today is a walking lunge. So I'm going to move this bench out of the way. And just move this camera so we can see. So I'll get you to jump off the bench and I'll move it out of the way for us. So a walking lunge, we'll start here, we'll go towards the camera. So walking lunge, I'll need you, let me just fix this. There we go. So walking lunge, we want to take a wide step forward and then drop that back knee down. We don't want to let it touch the floor, and then we want to push up through our heels. And then going again, with that foot you just kicked up, you want to take another wide step forward and dropping down that back knee. All right. Go. I'll tilt the camera so we can see you properly. All right, so large step forward. Really ease into that movement and don't let your knee touch the ground. Push up through your heel. Good, so step forward. Good, drop that back knee. And then come up, pushing up through your heel. Do you want to turn around and go back the other way? So don't let that back knee touch the ground. Ready, large step forward. Very good, push up through your heel. Nice, and go again. Push up. Good, one more. Push up. Nice. Thank you, Jane. So the justification for this exercise program is the 3 specific exercises were highlighted to show a glimpse into the overall exercise program and demonstrating 2 upper body exercises and 1 lower body exercise. All exercises focus on multiple muscle groups and targeting multi-joint locations to help increase and maintain bone strength. Arm raises was the first demonstrated exercise and was highlighted because it targets the shoulders, building the shoulders to the muscles and the bones surrounding Jane's original site of injury. As the exercise targets the deltoid, this will help improve her ability to lift overhead and perform overhead movements, especially in everyday life, reducing the pain that she feels. Like in the case study, she said discomfort when hanging washing on the line. As per recommendations for older adults performing resistance training, it is recommended for Jane to perform this exercise for 3 sets with 8 repetitions and a tempo of 2, 1, 2, 1. The weight prescribed is 3 kilos, allowing room for progression in the completed sets if the completed sets become too easy for Jane. To identify this, the rate of perceived exertion, or RPE, is assigned to 7 out of 10 or 3 to 4 reps left in reserve after each set is completed. If Jane identifies her RPE below this number, a progression is recommended if technique is correct. So a progression would be to increase the weight that she's currently using in the dumbbells. A slow progression, maybe 1 to 2 kilos each time, would be perfect. A regression for this exercise, if necessary, is to bend the arms, bend the elbows at a 90-degree angle when doing lateral raises, like so, or reducing the weight for both the lateral and frontal raises. Both regressions take the load off the deltoid to allow completion of the exercise and is advised if discomfort or inability to complete the sets occur. The dumbbells for the single arm row was also highlighted as it the dumbbell single arm row was also highlighted as it causes load through the clavicle to help strengthen the bone tissue and muscle supporting it, as it causes shoulder horizontal abduction, shoulder extension, scapular retraction, in addition to elbow flexion. The goal of this exercise is to bring mechanical load to the clavicle. Jane has been prescribed 3 sets of 10 repetitions for each side, alternating sides to allow rest in between each set. It is also recommended for Jane to use 6 kilo dumbbells to start with, using the similar tempo of 2-1-2-1 and 7 out of 10 RPE. So rate of perceived exertion, similar to the arm raises prescribed. As this follows the resistance training guidelines for older athletes. A regression for this exercise is to lower the amount of repetitions for each side. This allows Jane to still have the load through the shoulder joint, and a progression for this exercise would be to increase the weight to allow Jane to reach the target RPE assigned. For Jane to be allowed progression, correct technique will be analysed to also ensure the movement patterns are correct. Walking lunges was also prescribed to Jane, as it is a multi-joint exercise targeting the ankle joint, the knee joint, and also the hip joint. This exercise was highlighted to show an example of the lower body exercises in her program to build full body strength. As Jane mentioned, she has a family history of fractures, as her mother previously underwent a hip replacement surgery due to hip fracture. To avoid this for occurring for Jane, lower body resistance exercises are highly recommended to preserve her current strength levels. As her pre-exercise testing results show, Jane's lower extremity has a good result with no discomfort or pain noted in those exercises performed. So prescribing exercises to the lower extremity is designed to maintain this. Jane was prescribed 3 sets of 12 repetitions or 6 lunges each side in a complete set, using body weight only and tempo similar to the other exercises, 2-1-2-1. A target of RPE of 7 out of 10 is also recommended, with 3 to 4 in reserve. A regression for this exercise is to do stationary forward lunges, and if doing it near a wall for guided support, she can lightly touch the wall to help her stability and balance, and still using just body weight. This will take out a bit of the balance aspect to the exercise while she builds up that strength and ability to do so. A progression for this exercise would be to start holding dumbbells in each hand while performing the walking lunges. So for example, going up 2 kilos at a time. So starting with 2 kilo dumbbells and then slowly progressing 2 kilos at a time from there. This allows greater mechanical load, especially on the lower extremity, and gradually increasing to allow proper technique and ability to do so. All right, thank you.